I had total hip replacement on the right side. I don't know your actual term for it. And the incision was done from the front. Prior, I put it off for a while, so I actually had a couple years of being in pain. So I had, when I first started having issues going upstairs, I went to a surgeon to get a consultation, and he said, "Well, yeah, you'll need total hip replacement, but probably you can put it off a couple years or so." And I was so afraid of doing any kind of surgery that I was definitely up for that. I was like, okay, fine. Um, but it wasn't just a few months, and we had to move because I couldn't go up the stairs. I was on a third floor apartment and no elevator, so we had to get a ground floor apartment. And, it slowly just sort of decreased from there. Every time I stood up, there was some type of a jolt of pain. Any time of that movement where you're from a bent position to almost straight position, there was this portion that just really hurt, and it was every time. So every time you got up from a chair, you'd feel this. And then if I tried to get up and just start walking, the leg could give out sometimes, which was unexpected when you're first feeling that. You just think your legs do what your legs are supposed to do. So that first time it happened was such a shock. You're going, it's like, what, So I had to be careful. All of a sudden I had to watch what I was doing. I had to change how I did things. It was slow, so you don't notice it so much, but over time you don't realize all the things you give up because you realize it's just painful, so you just sort of stop doing it. And by the time I just said, no, I got to do something about it, and then came to Dr. Jamali, it was like I was shuffling. My steps were not real true steps. I couldn't walk very far, maybe, I don't know, the equivalent of half a block, and I'd have to like sit and rest, maybe a full block, but I had to stop and sit down. And then definitely no stairs. I couldn't pull myself up even off of a curb with my right leg. Everything had to be on my left. So those kind of things, just, you don't realize what you give up, but it's like you're just miserable after a while. So, like right after, obviously I don't remember the surgery exactly, but right after, the first big deal thing was waking up and needing to shift in my body a little bit, because before it's like any slight shift or jarring motion would cause a shooting pain. So it was like shifting in bed a little bit or whatever, and that original pain that I had lived with for so many years was just not even there. I mean, yeah, I was muscle sore or the soreness from the incision, that kind of stuff was there, but that was all new. That was nothing I've had dealt with before the surgery, so obviously that was just from the incision. So anything that I had felt before, that was all gone. And that was like a big, amazing, like, wow kind of a moment, It's like you wake up from surgery and you're like, within just a few hours, I could sit up by myself. I could do whatever I needed to do. So that was kind of like a really big eye opener. It's like, wow, that was cool. And every day was just these little improvements. It's like the next morning it was like I could get up and go to the restroom. And just it was like, wow. I mean, with a walker, obviously, but still, it was like those were just awesome, awesome things. And just, okay, it hurts because of this incision, but that was the only thing I had to deal with. So then it was just, let's just get stronger and go from there.